Okay, so today we're going to go over IV therapy and calculations for the first half of chapter 25, okay? So this is just a copy of your SLO. So by the end of this lecture, you will hopefully be able to calculate an IV fluids using the pumps, using the gravity and drop factor, and the calculations for IV push. You'll also be able to formulate nursing care therapy for patients receiving IV therapy. So what does that mean? So you're gonna be able to use the nursing process to implement IV therapy. So what do you do before? What do you do during? What do you do after? Who needs what? Why do they need it? Things like that. Okay. All right. So osmolality, tonicity, and the movement of fluid. So osmolality is a concentration of the osmotic solution. Think of it like your cup of coffee, okay, with the awful coffee grounds. Okay, so the osmolality is how many solutes, or coffee grounds, there are in your cup of coffee. Okay, so we're going to measure it. Dependent on the number of dissolved solutes in 1 kilogram or 1 liter of fluid, it doesn't matter what fluid it is. It can be blood, it can be urine, it can be CSF, it can be gastric fluid. You can measure the osmolality of anything, okay? So what are we measuring though is how many solutes. So the solutes could be sodium, it could be glucose, it could be urea, okay? Which is found in urine. So we're measuring how many solutions are in that the bag of fluid or the cup of fluid. So changes in osmolality can cause water to move to different compartments. We know that, right? We've all had biology when we did the biology experiment where you had a very big, or we've all cooked. You had a big pot of water, you add a bunch of salt, you add your potatoes, and all the salt goes in the potatoes, right? So the changes when you added the salt, when you added the potatoes, you changed the osmolality. So it had to become equal. So that's called the osmosis, the movement of water and solutes across membranes to make it equal on both sides, okay? Tonicity is a relative concentration of IV fluids. So how many salt, it's just how you measure the IV fluids, normal saline, LR, half normal saline, those kinds of things, okay? It's not a precise measurement. So osmosis is the movement of water from an area of low osmolality to an area of high osmolality, okay? Hypertonic moves from interstitial space to plasma, okay? So we're pulling it from wherever extra it is to the blood volume so we can get it out, okay? So when we have lots of edema, okay, we're pulling it in to push it out. All right, hypotonic is when water moves from the plasma to the interstitial space. So now I have too much in my blood or my blood vessels and I need to move it out, okay? And then isotonic causes no shift. So as we know, your kidneys do most of the fluid regulation, okay, through the renin-angiotensin-aldosterone system, through the aldosterone system, through the ADH, okay, or antidiuretic hormone. That's AMP. This is just a review, okay? So someone who has deficient fluid balance, someone in fluid volume deficit, what causes it? Usually dehydration or shock or hemorrhage or things like that, okay? How do you treat it? If they're awake, you can give them oral fluids, but if they're not, or if they're very severely dehydrated, we use IV fluids. If someone has excess fluid, how do we get the fluid out? We get it through diuretics, okay? So crystalloids versus colloids. So both of these replace fluid and electrolytes, whether it's from a loss of water and electrolytes through vomiting, diarrhea, laxatives, burns, precipitation, hemorrhage. So like your minor losses, just vomiting, your diarrhea, excess suctioning. Your extreme water and electrolyte losses are the precipitation, burns, bleeding out into your abdomen, things like that, okay? Hemorrhaging, excessive diuresis. So my sugar's too high, or I have SIADH, okay, which is syndrome of inappropriate antidiuretic hormone. So I'm peeing way too much, okay? Crystalloids. So crystalloids are IV solutions with electrolytes that are capable of leaving the plasma and moving to the interstitial spaces. So or in intracellular fluid. So it has all of the solutes that are in those solutions are small enough to be able to move, okay? They're used to replace fluid and promote urine output, and they have isotonic, hypertonic, and hypotonic. And then we have, what are those? Isotonic. So like we said, it expands the circulating intravascular fluid volume without causing the shift, okay? So it's used for hydration, and to expand extracellular fluid. So we need more in our plasma and we want it to not move. We want it to stay there. So we want isotonic, okay? We don't want it going into the interstitial space. We want it to stay in our blood vessels. So that's when we use isotonic. Hypertonic expands plasma volume by pulling it from somewhere, okay? So isotonic just gives you what you need. Hypertonic pulls the excess that you have, okay? So think about the potato and the salt, okay, right? So they pull all the water inside the potato because it's got all this extra on the outside and it's trying to make it even on both sides. So you have all this extra water, whether it's through cellular edema, cerebral edema, or peripheral edema, and it's pulling it into the plasma or into the blood vessels so that it can get out, okay? So this is using water you already have, it's pulling it and that's how it expands your plasma volume. A very interesting thing is that a lot of the D5 hypertonic solutions are hypertonic, but as the dextrose becomes metabolized, the solution actually becomes hypotonic, causing the water to shift into the intracellular space and relieving the dehydration within the cells. So if I had, let's say I had such bad peripheral edema or cerebral edema, all the extra fluid is outside the interstitial space. So I give you the D5 half normal saline, which is what that is right here. I give you the D5 half normal saline, so that's pulling the water into the plasma, into the blood vessel that you have extra, right? Because we have edema. But my cells are still dehydrated. So then after the dextrose is metabolized, the hypotonic solution is going to hydrate my cells, okay? So now we're into hypotonic. So it causes water to move from the plasma, out of the plasma to the tissues and cells in the intracellular compartment. So it's taking the water that you have excess water in the vessel and putting it either in the cell or in the tissue, okay? So they're not plasma expanders, right? They're not volume expanders. They're not helping your volume because your volume's already too much. So we use this for hypernatremia. So when my sodium's super high and I want the water to move so that it can regulate, or cellular dehydration. Okay, so I want the water to go inside the cell because my cells are dehydrated. And then colloids are solutions where the molecules or the solutes inside the solution are too large to pass the capillary membrane. So we call these volume expanders because they are going to stay in the plasma and in the blood vessel, okay? So they stay in the intravascular space and they rapidly expand your plasma volume. So they increase your blood volume, okay? They draw water from the intracellular fluid and interstitial spaces into the plasma. So remember, in isotonic, the way this is different than isotonic, okay, is isotonic doesn't let anything move. It all stays within the vascular and everything stays in the extravascular and the extra. In the intra, it stays in the intravascular and intracellular, okay? This will pull the water from everywhere else and put it in your plasma and keep it in the plasma, okay? So that's how they're different. An example of that is Dextran 40. Okay, Dextran 40 is an IV route medication. It's used for volume expander. So we use it for fluid volume replacement for hypovolemic shock. What is hypovolemic shock? Low volemic volume. So I have so much volume loss that I'm in shock, okay? Whether this is from dehydration, hemorrhage, surgery, burns. So we use that for all of those things and for the shock, okay? So once again, it raises the osmotic blood pressure by causing fluid to move from the interstitial spaces into the intravascular. Has several minute onset, unknown peak, 12 to 24 hour duration. An adverse effect: high blood pressure. It's a big one, right? Because if you're raising my osmotic pressure, which is the pressure within inside the vessel, if you're raising that, of course, I'm going to have high blood pressure if you give me too much. Okay. If the pressure in the vessel is too much, my blood pressure can go up. The fluid volume overload, which is a thing we have to look for any kind of IV therapy. Okay. So in this and metabolism, we have to look for fluid volume overload with everything. Because if we give too much replacement, we're going to see these symptoms like tachycardia, peripheral edema, distended neck veins, dyspnea, cough. Okay. That is a sign of fluid volume overload. We've given them too much and we need to back off. Okay. And then anaphylaxis. Obviously, you can become allergic to it. There's no specific drug-to-drug interactions, no food interactions, and the treatment, if you have normal kidney function, is to just stop the infusion. So if you start seeing the fluid volume overload symptoms, we stop the infusion and everything will, as I pee it out, it'll fix itself, okay? Now, if I don't have kidneys that work properly, I may need an osmotic diuretic to help, okay, get it out. Contraindications, kidney injury, right? If I have an acute kidney injury, I shouldn't get a bunch of volume expanders because I'm not going to be able to pee out what I don't need, okay? Severe dehydration. It's not going to help. It's going to make it worse. We don't use dextran for that. Severe heart failure. If you're in heart failure, you should not receive fluids, especially a large amount of fluids, and especially a volume expander, okay? So why not though? If their blood pressure is low, if they're dehydrated, why are we not going to fix it? Because we're going to kill them, okay? So in heart failure, if my heart already cannot pump what blood I have and what plasma I have, okay? So it's already struggling with what I got. If I rapidly increase that volume, my heart's going to not know what to do and it's going to stop, okay? You can throw them into fluid volume overload like that because their heart cannot compensate and pump the plasma, the volume that you've rapidly give them. If we give someone fluids with heart failure, we have to look out for fluid volume overload. It'll happen like that, okay? When we give them fluids, we go low volume, very slow IV, okay? Whereas if I was dehydrated, I was in shock, you could give me a liter of fluid in 10 minutes or less. Someone with heart failure, we're not doing that. We're going very slow. They're only getting a 250 bolus, maybe, okay? We go very low volume, very slow administration because we don't want that. They'll use something else besides volume expanders to get their blood pressure up to help with their dehydration, okay? Also hypervolemic disorders, it's a contraindication. If I already have too much volume, don't give me anymore, right? So there's specific guidelines for how much and how fast you can give it. If it's an emergency, I'm dying, I'm hemorrhaging out, the only way you're going to save me is through these volume expanders and surgery. You can give it to me very fast, 1.2 to 2.4 grams per minute. And if it's just regular dehydration where I'm awake and I just need IV expansion, you have to give it very slow at 240 milligrams per minute, okay? And obviously whatever is in the bag, if you don't use it, you got to throw it away, okay? That's with any IV bag. They are single patient only. If you don't use all of it, throw it away, okay? We don't reuse them, not for other people, not for that patient. If you don't use it, throw it away, get a new bag. It's all good, okay? So what am I going to do for this patient? I'm going to monitor vital signs, blood pressure especially, right? And tachycardia. I'm looking for those fluid volume overload symptoms. I'm looking for that hypertension, okay? I'm making sure that their shock symptoms are getting better, right? Or if they're getting worse, if I'm not going fast enough, if I'm going too fast, okay? And then obviously I'm looking for that fluid volume overload, okay? So, IV infusions. So there's different types of infusions, okay? There's replacement fluids, there's maintenance fluids, continuous fluids, intermittent fluids, okay? Replacement fluids, I threw up 500 mils of gastric fluid, so you give me a 500 milliliter back, okay? I had surgery and I hemorrhaged or I bled a bunch, you know exactly how much I lost, so you give it back, okay? That's replacement. Maintenance and continuous fluids, Continuous is all the time. Don't stop them unless it's discontinued. Maintenance, to me, they're the same. They're very similar. Okay. It's to help sustain normal levels of fluid and electrolytes. When I was on the stroke floor, everyone got a normal saline 125 mils an hour until speech pathology had cleared them to eat, because we didn't know when they were going to be able to eat again. So we had to replace their fluid and their electrolytes because they weren't allowed to eat or drink at all until this happened. So these are maintenance fluids. They're continuous. They're around the clock. We don't give little boluses here and there. Okay. Intermittent IV infusions are when you administer drugs, supplemental fluids every now and then. It's not all the time continuous. Okay. So these are IV piggybacks, IV PV, or IV push. And then we have our primary versus our secondary line. Okay. So this is what a primary line looks like. This is just a normal IV line. They have you have your bag, you have your drip chamber, you have your Y site, it goes to the pump, and then we have our clamp, and then it goes to the patient. Okay. This is a secondary line. So now I need to I have my normal saline going, but I need to hang an antibiotic for 30 minutes. It needs to go for 30 minutes. So it's most of the secondary or piggyback lines come with a little hook. We want to use the hook on that primary line because we want to use gravity to help us, right? Something higher is going to drip faster than something lower. So we're going to help the little machine out by putting this higher than that. Okay. So we connect it to that little Y site, and then we set the pump to give the secondary infusion. So the piggyback can be concurrent, which means both of them go at the same time, or it can stop A, give all of B, and then restart A. It's a very smart pump. Okay. The biggest deal problem is that you have to make sure these are compatible. If A and B are not compatible, if my push isn't compatible, if something isn't compatible with what's going, I can't do it. Okay. So I've had someone have, let's say I have to give them 2 antibiotics, right? This vancomycin is going to take 3 hours to be given, and I need a 30-minute Ancef. Okay. They can't be hung together. I would need a whole nother set. I would need 2 of these, 2 separate poles, 2 separate pumps, 2 separate IV sites. Okay. Because they're not compatible. Now, if they were compatible, we can hang them up, set it to go concurrent, then he can get both of his antibiotics at the same time and it's done. Okay. But if these are not compatible, you cannot hang them together. Okay. You will hurt someone. It will crystallize, bad things happen. Okay. So before you push anything through your IV site, you hang anything in your secondary line, you have to check compatibility before you do it. Okay. So IV medication safety, check every 30 minutes to 60 minutes on is it flowing? Is it kinked? Is the site looking good? Is it red, infiltrated? Is the flow rate going well? And make sure your pumps are plugged in. If the battery dies, the pump's no good. It stops. Sometimes it never comes back on. Be sure they're plugged in. Okay. And these are just different examples of IV bags. They're from your book. So this is a 5% dextrose infusion. There's an expiration that she's covered up. It tells you how big it is. So this is a 1000 ml bag. It also counts down. Okay, so if we've had 100, 2, 3, 4, 900, and then this is the last 100. So this is a 50 ml bag of normal saline. There's the expiration somewhere. 5% dextrose and half normal saline, 500 ml bag. We've got our numbers over here, our lot and our expiration. They've just blocked them out. So this, there's 2 sites, as you've noticed. This one is used to spike your tubing and prime your tubing with. This one is for a needle port entry. We don't use it. It's not safe to make your own bags. Now, in an emergency, we do, but they don't like us to keep them hung for very long because this should be a sterile procedure and done in the pharmacy, and they do it under a hood. It's like a very specific process they use, and it's a sterile technique. And if we're making it a bedside, we're not doing all of those things. So it's a very, it's a higher instance that we might have infected this whole bag with something. Okay. So they don't like us to use that. Don't touch it. Keep it clean. Otherwise, that's what it's for. Okay, and this is a bag of LR. It's 250. We've got our numbers, we've got our lot, our expiration. We've also got a brand on this. I don't know if you can see it, the Braun. All right, so gravity systems and pumps. So the size in your tubing for the drip chamber, for the hole that pulls the fluid from the bag into the drip chamber, the hole is not standard. So however many drops equal 1 milliliter is different. Okay, so manufacturers specify the number of drops that equal a mil for a particular tubing. It's found on the bag, just so you know. When you grab your IV tubing, it'll tell you how many drops per mil and how many mils per minute it can give the infusion. So we call that a drop factor. So the drop factor is how many drips per milliliter. Okay, that's a drop factor. You have to know the drop factor to find out the flow rate, right? So drops per minute, micro drops per minute tells me how many milliliters an hour. We're going to learn how to figure that out. Okay. So these are just different manufacturers, different drops. Okay. As you know, most of the micro drip sets are 60 drops per mil. All right, so now we're going to go into practice of how to calculate milliliters an hour, drips per minute, and how to go from back and forth between both. I'm just going to be forewarning, I had to learn a new set of math skills to teach this drop factor. Okay, so we're going to learn together. Okay, and if you still don't understand it, please email me and we will try to figure something out. Okay. All right, so flow rates, they're in volume over time. So drips per minute, milliliters per hour. It's volume over time. Okay. So first example, and these are from your book. We have a liter of fluid or 1,000 milliliters that needs to go continuous IV for 24 hours. How many milliliters per hour are we going to be able to set the pump to? So I'm going to give you 3 seconds. If you need time, please pause it. Okay. All right. So pretty simple. We just divide 1,000 by 24. Okay. We'll get 41.6 and we're going to round that to a whole number of 42 because you can't set the pump at a decimal very often. All right. Example number 2. This client needs to receive a tube feeding of Ensure for 120 milliliters in over 90 minutes. How many milliliters per hour are we going to be able to set the pump? All right, so the way I know to do it is called dimensional analysis. This is ratio over ratio proportion, okay? So we're gonna go over dimensional analysis first because that makes the most sense to me. So my question is asking for milliliters per hour. So I wanna make sure my milliliters is on top and my hours on bottom. So I put my 120 milliliters on top. It needs to go over 90 minutes, okay? 90 minutes is not a whole number for an hour. So I need to do my conversion for 60 minutes is 1 hour. My minutes cross out, okay? And I'm left with milliliters over hours, which is what my question is asking for. So that makes sure, that is how I am sure that I have all the information I need. If everything is crossed out that I don't need, and I'm left with what the question is asking, I've got it correct. I've got it set up the right way, okay? And you see, it's got to be the right setup too. My milliliters have to be on top, my hour has to be on bottom. So if I multiply across 120 times 60, and then I divide that by 90, I get 80 mils an hour. Okay, so ratio over proportion. So I have my question, my answer, right? I have my 120 milliliters over 90 minutes. I need it for it to be 60 minutes. Okay, so the same thing on top has to be on top. They have to equal each other. Okay, it's not like over here where they have to be opposite. These have to be on the same side. So milliliters, milliliters, minutes, minutes. So I know my milliliters, I know my minutes. That's my order. Okay. Now I don't know how many milliliters need to be in 1 hour or 60 minutes. So I cross multiply. So 120 times 60 is 7,200. And I cross multiply over here. So 90 X equals 7,200. And then I divide by 90 to find X, and X equals 80. So 80 mils an hour. Same, there's a multiple ways. And I'm sure there's a whole nother way to do this, okay? If you still don't understand it, please let me know. All right, so D5W has been infusing for 30 mils an hour, IV for 8 hours. How many milliliters have been infused? All right, so I did it the easy way. I just multiplied 30 times 80 and it gets 240. You set it up in the dimensional analysis way. My question is asking in milliliters. So I want to make sure I'm at my milliliters on top. That means that's all I want. Everything else has to cross out. So if 30 milliliters happens in 1 hour, how many will 8 hours, because my hours will cross out, in 1 goes on the bottom because we don't have anything under 8 hours. So you multiply across and it's 240, and then you divide by 1, it's still 240. So using my ratio of proportions, my milliliters have to equal. So I have 30 milliliters equals X amount of milliliters because I don't know how many. That's what my question's asking. 1 hour and I have my 8 hours. I plugged it all in correct, right? And then I cross multiply and divide. So 30 times 8 is 240. All right, so now we have normal saline 500 milliliter IV at 125 an hour. How long will this take? All right, so 500 milliliters. We're looking for hours. How many hours will this, how long will this take in hours? So I want to make sure my hours are on top. I have my 1 hour over 125 milliliters, okay? My only other milliliters is this 500 over 1. I multiply across, and then divide, and that equals 4. So 500 divided by 125. I just divided the two, and then I set it up like this to show you. Or you can just say 125 plus 125 plus 125 plus keep going until you figured out how many equaled 500. The other way to do this is the ratio and proportion. So once again, I have to make sure that everything on top and everything on bottom matches. So I have my 500 milliliters and my 125 milliliters. I have my X amount of hours because we don't know how many, and my 1 hour. I cross multiply. So I have 125 X, because we don't know what X is, equals 500. And now I divide my 125, and that equals 4. All right. The order reads for 125 milliliters of 5% dextrose in water, IV for 1 hour. What is the flow rate and micro drops? Once again, I'm giving you a couple seconds. Please pause to figure this out yourself, okay? All right, so this is 125 milliliters in 1 hour or 60 minutes. We will, because we want drops per minute. That just took out a whole step for us. So let's just go ahead and convert it because we know 1 hour, 60 minutes. Now we have micro drops per minute. That's what we want, right? So I have my micro drops on top, my minutes on bottom, and my milliliters can cross out. Micro drops, we know from the conversion earlier, there are 60 micro drops in every milliliter. So that's where I got this conversion from. 60 micro drops are in every milliliter, okay? So I plugged it in. My milliliters cancel out. I'm left with micro drips over a minute. So 125 times 60 divided by 60 is 125. So 125 mils an hour is 125 drops per minute. Micro drops per minute, sorry. All right, so now we have this new way of, this new one, okay? It's called factor converter. That's what the FC stands for, factor converter. So the factor converter equals 60 divided by your drip factor, okay? It is always 60 on top and then drop factor on bottom, okay? And that will give you your factor converter. Then you have to decide if you're going to multiply or divide, okay? This is how they want you to remember it. So if you want to If you want drops or micro drops, you divide D and D. If I want milliliters, I multiply. So I find my factor converter and then I do whatever the question's asking, okay? So my factor converter, 60 divided by my drop factor, which is 60, okay? That equals 1. This one's easier, so it's different, but we'll get harder, okay? So then we take our milliliters and we're asking for drops. So we're going to divide, okay? We take our milliliters and we divide by our factor converter, and that's how we got our drops per minute. This seems kind of weird right now, but when we get a little further, it'll make more sense, okay? All right. So how many milliliters of D5W will infuse IV in 10 hours at a rate of 13 drops per minute if the drop factor is 15 drops per mil? Once again, pause if you need to. All right, so the dimensional analysis way. I plug in all my numbers. I want to know hours, okay? So I've somehow got to get that up top. Let's figure it out. So I want my 10 hours on top. So I have 13 drops. I'm sorry, we don't want to know hours. We want to know milliliters. My bad. So 13 drops per minute. 60 minutes, 1 hour. 10 hours over 1 mil over 15. So I put in all my numbers that I have and I make sure they're opposites from the conversions, and then I make sure I'm left with what I'm asked for, okay? So my drops cancel out here, my minutes cancel out here, my hours cancel out here, and I'm left with my milliliters, which is what the question's asking for, so that's how I know I got this right, okay? I've used all the numbers, I've plugged them in appropriately, I'm left with my milliliters on top. That means I'm gonna get my question's gonna be in milliliters, okay? So if I multiply 13 times 60 times 10, I get 7,800 divided by 1 times 1 times 1 times 15 is 15. You get 520 milliliters. This one's a little longer, right? Okay, so we took our 10 hours, but we don't know how many milliliters. So that's what we're trying to figure out. How many milliliters in 10 hours? Because we had to convert our drops per minute to our milliliters per hour, and then we had to figure it out times 10 hours. Okay. So factor converter. So once again, factor converter, 60 on top, our drop factor on bottom. So our drop factor is 15. So we divide 60 by 15 and we get 4. Okay. All right. Now, the question is asking what? For milliliters. So milliliters, I multiply 4 times our 13 drops to get our 52 mils an hour. I know. It's crazy, you already got milliliters per hour, okay? So now we have milliliters per hour, and we want to know how many milliliters per hour, how many milliliters will they be given in 10 hours? So you could just multiply by 10, or you can do the ratio over proportion way and do 50 milliliters is equal, I'm sorry, that's supposed to be an equal sign, is equal to X amount of milliliters. 1 hour over 10 hours, you cross multiply, you get X equals 52 times 10, X equals 520. Get a little crazy there, huh? Okay, please let me know if you have any questions. There are lots of examples in your book. Please use them to your advantage, okay? All right, so an infusion of 5% dextrose in water is infusing at 20 drops per minute. 500 milliliters of the solution was originally in the bag, and the client has received 200 milliliters, okay? If the drop factor is 15 drops per milliliter, how many hours will it take for the remaining solution in the bag to infuse? Okay, so this is going to be broken down dimensional analysis. So first you have to find out how many milliliters are left in the bag. 500 minus 200 is 300. Okay, so now we know how many milliliters we have. to infuse. We want to know how long it's going to take. So we're looking for hours. We're going to put our hours on top. Our 1 hour over over 60 minutes because we know we have 1 hour equals 60 minutes and we have a minute up here. So then we do our 1 minute over 20 drops so that our minutes can cross out. We're going to put in our drop factor of 15 drops per ml so our drops can factor out. And then we're going to put in our remaining solution, our 300 mils, so our milliliters can cross out. And I'm only left with this hour over here. Okay. Multiply across, divide 3.75 hours. All right, now let's do it the factor converter way. So once again, we have to figure this out at the beginning for later. So factor converter is 60 over our drop factor. Our drop factor is 15. It equals 4. We're looking for milliliters, so we want to multiply. So 4 times 20, because that's our how many drops per minute, equals 80 mils an hour. Okay, so now we have our 80 mils equals our 300 mils. 80 mils over 1 hour. How many hours is the 300 mils going to take? You cross multiply, and then you divide. So we get 80x equals 300, and then you divide by the 80 and you get 3.75. I kind of like this. This is a lot simpler. All right, and then our last one is an IV push, which is what you've been doing since the beginning. Okay, so if I have an order for 2 milligrams IV push to be given once, and my available is morphine 4 milligrams per milliliter, how many milliliters am I going to give? We're going to figure it out. 0.5 ml. All right. You know how to do this one. I don't need to explain it, right? All right. So I put my milliliters on top because that's what my question's asking for. The only other milliliter I have that is attached to this milliliter, you can't separate them ever, is this 4 milligrams. I put my milligram on top so my milligrams can cross out. I multiply across, divide, it's a half. Or my desired over half. Desired over half times 1.5. All right, and that is IV calculations. That was only a couple examples from your book. I very much push that you need to do all the examples in your book so that you can get the practice. There is going to be a practice set on your on Canvas to do as well. If you have any questions, please put them in the discussion board. Please email me. Do the mandatory quiz. It'll help. All right. Good luck and goodbye. Okay, so because we didn't explain how to do desired over have, I'm gonna do just a little addition on the end of this to help explain it so that y'all can understand it, okay? So we're gonna do the same problems, but we're gonna do the desired over have way, okay? So a client must receive a tube feeding of Ensure of 120 milliliters in 90 minutes. Calculate the milliliters per hour. So for desired over have, the equation is not for the drop factor, and for a lot of the things, it's volume over time. Okay, so when we do it, we have to first figure out. My computer's being really slow, and I'm really sorry. It's probably gonna close. Please don't do it. Please don't do it. So first we have to decide to find out how many hours, because that's what the question's asking for. Okay, so how many hours is 90 minutes? So you divide 90 minutes by 60 minutes because we know that's 1 hour, right? And it's 1.5 hours. Okay, so then we take our volume over our time. So our 120 milliliters over our 1.5 hours, and you get 80 mils an hour. It's very straightforward. Okay. All right, so we're gonna do another one. So now we have a D5W that's been infusing at 30 mils an hour for 8 hours. How many milliliters have infused? It's pretty simple. So you could literally count it 30 at 8 times, or you could multiply 30 milliliters times 8 hours. It's 240. Okay, it's pretty simple. All right, so now we have an order for normal saline, 500 milliliters at 125 an hour. How long will this take? So once again, we're looking for how long will this take? We're looking for hours. Okay. So volume over time. Okay. Volume over time. So 500 milliliters, sorry, it's not, this is the desired over have. Our desired is 500 milliliters. We have 125 milliliters times our 1 hour. You just divide it and it's 4 hours. Okay. Or you could say 125 plus 125 is 250 plus 125 plus 125, or just, you can figure it out that way too. All right. So now we're going to get into a little bit different. Okay. I messed up on this, but that's okay. My computer's being very slow. So the order is for 125 milliliters of 5% dextrose in water, IV in 1 hour. What is the flow rate in micro drops per minute? So we're looking for micro drops per minute. Okay. So our order is 125 an hour, right? In 1 hour. And our flow rate is micro drops per minute. So first we'd figure out micro drops. So there are 60 micro drops per 1 ml. Okay. And there's 1 hour is 60 minutes. So our volume over our time times our drop factor, which is the 60. I know I put drops and that's where I said I messed up. It's supposed to be micro drops per ml. Okay. It doesn't change anything. It's the same thing. 125 divided by 60 is 2.083 repeating. Keep that number. It's ugly and fat and nasty. I know. Keep it in your calculator. Do not round. Okay. Do not put 0.083 in the calculator. Keep it the 3 repeating. Multiply by the drop factor and you get 125 micro drops per minute. Okay. I know I used three different, I'm so sorry, 3 different labels. My computer was messing up this morning and I didn't even catch that. Sorry about that. All right, so now we have how many milliliters of D5W will infuse IV in 10 hours at a rate of 13 drops per minute if the drop factor is 15 drops per milliliter. Okay, so this one's a little different, but not too different, okay? We still have a desired over a have, like a desire or an order, okay? So I have an order of 13 drops per minute. I have um a drop factor of 15 drops per mil. So 13 divided by 15 times our volume, okay? And we get 0.086 repeating. Remember, keep it big, ugly, nasty. That will give us our milliliters per minute, okay? When we multiply this big, ugly number by 60 minutes, because 60 minutes are in an hour, right? You get 52 milliliters an hour now. Okay. Now I want to know how much will infuse in 10 hours. So if it's 52 milliliters an hour, I just multiply 52 times 10 and I get 520. Okay. So this one's like a little mix between desired over have and our volume. Okay. So we have our desired, which is our order, our have, which is the 15 drops. I think of my have as my rule or my what I have literally in my hand and what's on that pump. The pump says 15 mil, that's the drop factor. I gotta have that to use in my formula. Okay. So 13 drops per 15 divided by 15 times our volume. Okay. Do you see where it's coming from? Okay. So we've crossed out these drops. We have milliliters. We still have a minute up here, so it's per minute. We have to make it per hour because I mean, I guess you could divide 10 by 60 and figure out or 10 times 60 and multiply this number by that big number if you want to. It'd still give you 520, but it makes more sense to do 0.6 milliliters per minute times 60 minutes to get me 52 mils per hour. Okay. All right. Okay. So
Now we have a little bit more complicated. An infusion of 5% DW dextrose in water is infusing at a rate of 20 drops per minute. It was a 500 milliliter bag, and now they've received 200 milliliters of the 500 milliliter bag. The drop factor is 15 drops per milliliter. How many hours will he get the remaining? Okay, so I rewrote this question because that's where I always start with rewriting my questions, okay? So my order is for 5%, who cares? At 20 drops per minute. Okay, that's my order. My rule is my drop factor, my 15 drops per milliliter. So my order over my have, my desired over my have, that's what it is, okay? The question is asking for remaining 300 milliliters in hours. Where did I get 300 from? I subtracted 500 from 200 is 300. So it's asking how long in hours will it take to infuse this 300 milliliters? So first we have to figure out we don't have any hours to even go on. We don't have a milliliters per hour to go on. So we got to find out a milliliter per hour, and then we can figure out after that. So, okay. Remember our desired is 20 drops because that's our order. Our rule or what we have is our 15 drops times our milliliters. Okay. So 20 divided by 15 is 1.3 milliliters per minute times 60 minutes, because 60 milliliters minutes are in an hour. Okay. It's 80 mils an hour. So now we have a rate in milliliters per hour. It wants to know, the question's asking for hours. So we can easily figure this out. We have our 300 divided by 80 because we know these are hours, right? It's 3.75. So when you're looking for the time, you can divide like that. Um, you when you have the volume and you're looking for the time, you divide, right? When we did this one back here, we had opposites, so we multiplied. Okay. You have to think through the problem. You have to think, okay, is this a multiplication or does this a division? Like, if multiplying it's going to get me my time, or will dividing get me my time? So, all right. So we're gonna do one more. This one's an extra one. We didn't do this one for everyone else. We're only gonna do it for you because I wanted you to have one more practice for this drops per minute, because this is kind of what we're learning. Okay. So, you have an order for 1,000 milliliters of D5W. It's always D5W. Why do they use that one so much? IV over 8 hours. The drop factor is 10 drops per milliliters. Okay. Calculate the initial flow rate in drops per minute. So, order 1,000 mLs per over 8 hours. Our rule drop factor is 10 drops per mil. Our question is drops per minute. Okay. So when you see questions like this, rewrite them. It helps. Okay. So we have our volume over time times our drop factor. The rule is, okay, when you're doing this time, the time needs to be in whatever increment it's asking for, or you're not going to get the right answer. I could do this divided by 8, but then I'd also have to figure it out by 60 later. Okay. So I think, this is my opinion. You can do what you want. Okay. I want this already done. That way I don't have to think about it later. Okay. So 8 hours, we have to change this 8 hours to my minutes for my time, because that's what the question's asking. Okay. So 8 hours times 60 minutes, sorry, I didn't label it, is 480 minutes. Okay. So now I have a new order is 1,000 over 480 minutes. I have a rule and I want to know my drops per minute. So my volume is 1,000 milliliters because that's the only volume I got, right? My time is 480 minutes. And then I multiply by my drop factor, 10 drops per ml. Okay. So if you think, I know y'all don't like dimensional analysis, but it helps my brain at least to think like this. Okay. If I cross these milliliters out, I'm left with drops per minute. Okay. Because it's basically dimensional analysis. um, you're left with drops per minute. So 1,000 divided by 480 is 2.083. Ugly number. Leave it big, leave it ugly. You multiply it by 10 and you get 20.83. Depending on how the question is asked, the question will tell you how to round. Do you round to the tenths? Do you round to the hundredths? Do you round to the whole number? Okay, so that's why I put a couple options up here. But this will give you the drops per minute. All right. There is a lot of practice online. If you need help, please ask someone. Ask your instructors, ask your clinical instructors. Someone can help you, okay? Sigma Chi should have I think it's Sigma Chi or no, the Honor Society for Nursing. That's who tutors. They tutor on Monday. If you need help with math, they can help you, okay? You can contact Miss Woodruff, which is in level 3. She might can help you with finding out when they're going to offer tutoring for that. Um, if you need any help, though, please do not suffer in silence. If you suffer in silence, you're not going to know how to do these. There's plenty of practice online. There's the website, there's quizzes, and there's extra practice sheets. I suggest you practice, 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 okay? Um, if you need anything else, though, put it in the discussion board and have a great day.